All right, so I said I would come back and do a talk about under eye fillers, so now we will do a talk about under eye fillers. I got a bunch of fillers to kind of show really quickly, so we finished surgery early, and I got a minute to explain. So if you got questions, you can ask them below, otherwise we'll post this later. When we're talking about under eye fillers, we're talking about volumization of this part of the cheek, infraorbital hollow, tear trough. Going down this way is a nasojugal groove, and this in between this part of the cheek and that part of the cheek is called the malar septum. This is where you get your malar rounds, malar bags, that kind of stuff. So under eye fillers, what you're trying to do is fill one part or correct one part of under eye darkness. Under eye darkness or dark circles come from hollowing, and the hollowing comes from the pooching of the eye bags. So the eye bags are held in by the orbital septum, and when the septum weakens over time as you get older, the fat underneath can start to pooch out. And if you look at mine, it's a good example because I've got one fat bag there. There's a muscle that goes across that keeps that part in a little bit tighter, and I have another bag kind of coming out over here. This fold over here is just muscle, and then here is where the sac connects into what we call the orbital rim. That's where the septum goes in, and then we have this under eye hollow. So as the cheek goes down and the cheek loses volume and the septum weakens and the fat comes out, then this part gets hollower and hollower. Okay, so that's number one, that's hollowing. Then we have the transparency of the skin. If you look at the skin, it gets thicker out here, thinner over here. The thinner it gets, the more you see this darkness of the muscle underneath. There's also something called an accordion effect, where the crepiness of the skin, as it kind of goes onto itself, it gets darker and darker. And the skin ages usually in this direction on the under eye because it medializes towards the nose like that. So again, the medial part gets darker because of the accordion effect, and when you stretch it out, it gets a little bit better. Then you have hyperchromia or hyperpigmentation. Pigmentation meaning you have little dots of pigment that actually form in your skin. Hyperchromia, just the color of it. So those are the main things involved in dark under eye circles, and when we're doing filler, we're just trying to improve the hollowing. So the important thing to know about the under eye is that it's probably the most sensitive part of the face to filler. And that's because of, I'd say, not poor lymphatic drainage, but restricted lymphatic drainage patterns. So the eye can drain in this direction, or it has to go out and drain in this direction. The fluid that kind of accumulates around it. The other part is that the eye itself is where we see a lot of allergies in people and a lot of sensitivity. So if you have sinus problems, which are down over here, they can emanate around the eye. If you have allergies, you see them in the eye. So the eye itself likes to retain water. It's very sensitive. It's got restricted lymphatic drainage patterns. And if you put a foreign material, any kind, including a filler in the under eye, you can have problems with water retention either now or in the future. So that means anytime you do something around the under eye, whether it's surgery or fillers, you have to be very, very cautious and also very realistic with problems that may occur because of it. So you just always have to know that. When we're doing fillers, we have to choose, do we want permanent fillers? Do we want temporary fillers or what? So permanent fillers in the under eye are pretty horrendous. That's using silicone, bioalchemid, PMMA, things like that. When you put those in the under eye, they can cause a lot of reactivity, a lot of problems, and will be a problem forever. It's very, very difficult to get rid of them, even with surgery. Then you have fat grafting. Fat grafting can be done in the under eye. Fat we take from the belly, usually, and we can go put it in the under eye. And people think that's a natural thing to do. I would never call it natural because it's not natural to take fat from your belly and put it in your eye. It's not natural. It is more of a natural product because your body produces the fat, but it has different receptors than the fat has in your under eye itself. So doing that also carries a risk. However, we do it all the time and we can get away with it safely, but we have to assume that in the future you can have a problem with it. So when we inject it, we have to inject deep and cautiously. So fat can have a problem in the future, just like silicone. It can hypertrophy, it can thicken, it can also draw in water, just like this. So let's get to fillers, which ones to use, which ones not to use. The ones that cause problems lifelong, just like silicone, is Radiesse. Radiesse is a calcium hydroxyapatite paste of a filler, and it goes in the under eye, and doctors like to use it because they think it lasts longer, or they think that the calcium crystals form collagen. It causes pretty bad scarring and crystallization in the under eye, and you never want to use Radiesse under any circumstance in the under eye. it will be there forever and you can never get rid of it. So Radiesse never goes in the under eye. Never. Sculptra, also, you have to be, I mean, I would never put it. Some doctors put it. I have many reasons for never putting it. Number one, it's the wrong place to try to form granulation tissue. You do not want to form granulation tissue in such a sensitive area with thin skin and veins that bulge up anytime they have inflammation around them. So Sculptra can cause mainly calcifications, which it would cause little tiny nodules all the way around, nodules that you would feel under the skin, and you can't get rid of them really unless you try to stab them over and over again with different substances or ultimately cut them out. So people hate it when a doctor places Sculptra in the under eye. The other reason they hate it, not just because of the problems, is that it never gives a benefit. Sculptra in the under eye would just form weird granulation bumps and lumps, and it wouldn't really have any soft, natural, sexy looking benefit to it. So forget Sculptra. So that's this guy. Sculptra is poly-L-lactic acid. It's a suture material. So maybe you'll understand when you look at these things. It's a powder that is turned into a substance, a liquid. So there you go. Okay, I barely use Sculptra. So Sculptra is this powder. Okay, powder like that, and you take it and mix it up with water, and it becomes just a fluid with powder in it. And you inject this powder or suspension into the under eyes. If you do that, you're going to have likely problems in the future because it just sits there and irritates the area and forms a scar for you. So let's get to the good stuff. Okay, so Sculptra, we said never do. Radiesse, we said never do. If you've had Radiesse in the past, you can have problems 5-10 years later. It doesn't mean it's going to happen to you, but it's a pretty good chance, and you won't even know it was Radiesse. You'll just think that forever you've had this dark, boggy, watery look to the under eyes, and you'll never know what it was. So let's say we go over to the hyaluronic acids now, so I can show you all these. Question, would you ever inject hyaluronic acid over the top of Radiesse, not just in the tear trough? In the tear trough, if you do that, likely you're just going to draw in more water. Once there's Radiesse in there and you put in another filler on top of it, you're going to aggravate whatever filler was already there. So it could be a problem. So let's see if we can flip this around. Welcome to my office. We have stones, we've got rocks, we've got kids, and then we've got fillers. Okay, so in the fillers, I will kind of go through all these different ones. The classic ones are these guys and these guys, okay? So this is Galderma, this is Allergan. Galderma, you have Restylane is the original, Juvederm 3 or Juvederm XC is the original. Ultra XC is a thicker version of it. Restylane, if you put it through a finer mesh, becomes Restylane Silk. If you put it through a thicker mesh, it's regular Restylane Lift, which used to be called Perlane. Okay, so thin, medium, thicker. And then we have, well, if you flip it the other way, whatever. So you have Juvederm Ultra XC is the thicker. Juvederm 3, which is Juvederm Ultra, is the thinner. So it's Ultra 3. It used to be just called XC. Either way. So thinner, thicker, thinner, medium, thicker. These are beaded fillers, which means when you pump them out, it's like a little gel material that comes out in beads. It's a clear gel. That means that you have to usually massage it to kind of smooth it out wherever it goes because it comes out as beads and it's not linear. So these are our classics. These are the newer technologies. So we have Voluma, you have Volure, Volbella, Restylane Refine, Kiss, and Define. So these are all fairly similar in their characteristics of linear fillers, meaning if you inject it out, it comes out as a strand of a connected gelatinous filler rather than these guys are beaded. And they have huge differences in how they react in the face and their dissolvability because their cross-linking is different between all these. Okay, so let's go start with the classics. So classic Allergan, which is Juvederm 3, Juvederm 4, or Juvederm XC and Ultra XC, should never be injected in the under eye. And I don't care if you dilute it or do anything to it. This should never be injected in the under eye. This should never be injected in the under eye. What happens? So let's say you inject Juvederm in the under eye, and you're a cowboy, and you want to go put Juvederm in the under eye because you think that they're all the same. And we've learned they might not be all the same, because I'm going to tell you all these terrible things that can happen. So in the under eye, you put Juvederm. Even if you put a little tiny bit, it might be okay for like a month. But what happens 2 months later, 3 months later, 4 months later, it starts to draw in water. It starts to clog your lymphatics. It clogs them, so you can't drain anymore, and your eye starts to get boggy. And what it gets is this tired, wet under eye look. Now your wrinkles go away. So some people think that's like a good thing. But your wrinkles going away in the same area as water getting drawn in and making it heavy and boggy is not a good thing. So that's what it does. It draws in water. People say it gives a Tyndall effect. It's not actually a Tyndall effect, which is a refraction of like blue light. It's just a crystalline appearing look underneath the eye, which makes it look dark blue or green. So you get a bluish green gray look to it, and people don't understand that it could happen a year later, it could happen 2 years later, and it can last 10 years plus. So even though the clinical effect or the positive effect of a filler goes away after about 6 to 9 months or a year, this is going to last with you 10 years plus. And then you have to try to go get rid of it. And getting rid of it is almost impossible. You can get rid of 80% of it, maybe 70% of it by dissolving, and then you dissolve again, and you dissolve again. But likely there's always going to be a little tiny bit there unless you're lucky. The good thing is Juvederm 3 and 4 can be dissolved because it's a beaded filler. And little tiny beaded fillers, because of their cross-linking, the hyaluronidase can go around those tiny little beads like a detergent and break them up. It can go in there and break up the little sugar molecules. So that's a good thing. Either way, never ever use these in the under eye. There is no reason, okay, unless you're like lost in outer space and somebody is saying, I force you to, use filler in your under eye and you have to use it. Otherwise, don't do it. Okay, so then we get to these products. Restylane Silk, Restylane L, which is lidocaine, and Restylane Lift, which is the old Perlane, which is also with lidocaine. So these have lidocaine in them. Restylane Silk is the finer one. The problem with Restylane Silk is that it's very inflammatory because it comes out in tiny, tiny little beads. And the second you put pressure on it, it disperses. So it causes a big inflammatory response. So that guy, no. Okay? Restylane L. Restylane is the classic that everybody's been using. It's time-tested, and the professionals all around the world would tell you that this is the one to use. Okay? So I'm saying that. Everybody else is saying that. So you should probably listen. I would use just Restylane L. Their Belotero is okay too, I'll go over that, but Restylane L is the better way to go. Some would say, hey, but Restylane Lift is made of the same material. It's the same thing as Restylane L, it's just less finely meshed, right? No, that's not true. If you put Restylane Lift in the under eye, it can cause the same problems as these guys. So this is a no. So we're left with this guy. This is the one that you can use. It's Restylane L. The benefits are, it's time tested. We've used it for years and years in the under eye, and out of all of them, this causes less edema, less migration, and less lymphatic clogging, I think, than all the rest. So, and Belotero, those two. But Restylane L lasts longer than Belotero and hurts less when you inject it for whatever reason. Maybe it's because it's buffered with lidocaine. So I would say use Restylane L. It's beaded. The benefit of a beaded filler, again, is that you can dissolve it pretty easily. And in an area that's hypersensitive and can always have problems, you want to make sure you can get rid of it. You don't want to have something permanent or inflammatory there that you can't get rid of. You want something that you can get rid of. So Restylane L is that filler. Belotero is also that filler. Versa is not that filler. So Versa is not going to go in your under eye. Versa falls into the category of these guys, which we'll get to right now. Okay, so Restylane L, that's your winner. We won't leave you in suspense. We'll leave that guy over there. These guys are trash for the under eye. Total trash. Total trash. Total trash. Voluma. Oh, you son of a bitch. So, Voluma. We love Voluma, right? Voluma is great for the cheek. Oh, that's expired. Okay, well, I don't use Voluma much, so we're going to have to trash that. So, Voluma is used mainly for the cheek out over here because it's got a nice G prime, meaning it's got resilience to it and resistance, so it kind of keeps nice accent to it. Some people think, ooh, but Voluma is more expensive. Don't I want to place that in my under eye? No, you don't. So these are in the linear class of fillers, which are they're not very hydrophilic, but they're slightly more reactive in this area because they can clog your lymphatics and they like to go into that muscle right here. Okay, so here's the other thing people don't understand. when you're filling the under eye, you're trying to fill up as high as you can. You come and fill up on the orbital rim, right on this bone, right as it goes into the orbit. That's where you're filling onto something called the SOOF, the suborbicularis oculi fat pad. And you can fill up all the way over here. Now, that's a sensitive area, but it's easy to fill. And you stay down onto the SOOF and you inject deep. And you use a cannula, because a cannula backtracks less, is easier to put micro aliquots, and it's a little more controlled than putting a needle in that area. And I've done them both ways a million different times. It's much better with a cannula. I use a 27 gauge, 1-inch cannula. It has the most control for me. You can use anything you want. So I use these Dermasculpt 27 gauge, 1-inch cannula. The reason I use a 27 is because it allows you to put a little bit better, smaller aliquot size. The reason I use a 1-inch is because I don't have to push as hard. If you use a longer one, you have to push harder and you're gonna pop off your needle, and that sucks. I have a 25 gauge, but I don't use it for that. I use it for other things. That's a 25 gauge, it's bigger. So I use a 27 and I fill under here. As I get to the side over here, you have to realize that the orbital septum has a denser attachment to a ridge here on the bone. You can all feel it there. If you feel there's a ledge there, that's where the orbital septum comes and attaches, is onto this ledge. That means that if you go inject into this ledge, if you inject into the periosteum here by accident, it's gonna pop into your lateral fat pad. Your lateral fat pad is densely attached to this area because of with the orbital septum there. So you have to be sure that here you can go deep because there's no overlying orbital septum. The orbital septum attaches on the internal part of the orbital rim. Here you have to go right over the periosteum, gliding on top of it, because otherwise if you hit the periosteum, you can inject filler into this fat pad here, and all of a sudden you have a bigger fat pad than you ever had. And you don't notice it right away sometimes. You might notice it like 3-4 weeks later as it starts to bring in water. Going medially, here's the tricky part. The tricky part going medially, there's a muscle here, a ligamentous attached muscle that you can call the orbicularis ligament or the orbicularis sling. And it's part of the orbicularis muscle, which is this muscle, and it attaches down onto the bone. It's very adherent down onto the bone and comes and releases right about there. So this area, if you accidentally inject next to it or into it, it's going to go into the muscle. And now the muscle gets myositis. It gets an inflammatory response, which is a hydrophilic inflammatory response. It draws in water and it turns into like a little sausage. And lots of people have that. A mild version of it is when little bits seep into the area and you smile and you get a deepening of the nasal sidewall here. This fat pad flattens and then you get a bulge there. That's a mild version. A severe version is when you can feel a kind of sausagey tube right there, and that means that it went into the muscle. And the worst one you could ever get in there is that guy, okay? And it happens a lot. I also see these two guys a lot. So it happens mainly with these three because people are cowboys. They try to get too creative and they're trying to use products that they shouldn't be using. This is the only product you should be using in the under eye, or Bellotero. So when that happens with these guys, including, let's see over here, we got Voluma, Volure, Volbella. What happens is it irritates the area, it draws in water, it does so slowly, and then you try to get rid of it, and these things are very hard to dissolve, especially in the under eye. So you have to go dissolve it, and every time you dissolve it, you can damage your own tissue. Fortunately, in the under eye, we don't carry much hyaluronic acid. We have very small amounts of hyaluronic acid in our thin little dermis, and we have little tiny bits in the soft tissue, but there's not much in the under eye. So when you dissolve the under eye, you're relatively safe from damaging your own tissues, but you do get an exaggerated dehydrational response when you do it. So people's eyes really sink the first week and they freak out. And the skin gets crepey because you dehydrated it by getting rid of the hyaluronic acid in their own skin. So this is the reason you do not want to use Volure, do not want to use Volbella, do not want to use Juvederm Voluma. So who tells you to use this and this? It's usually the reps. The reps come and tell you, hey, this other doctor is using it, they don't have any problems. And so you take their word for it and you start using it, and then a patient comes back and they're ultra pissed off at you and they want it gone, and you try to get it gone and it's very hard to get it gone, and you're injecting them with Dissolver, 5FU, all this stuff to try to get rid of it. So now we've got this class of fillers: Restylane, Refine, Kiss, and Define. And they're in this order because roughly the same type of product. This is the thinner, that's the medium, that's the thicker. Okay, great for fine lines, great for lips, great for cheeks, jawline definition, great for a lot of things. Not for the under eye. Okay, so these guys, not for the under eye, not for the under eye, not for the under eye. Definitely not for the under eye. Do not use Sculptra for the under eye. Do not use Radiesse for the under eye. So, in the end, the best filler, and this goes, you can question it, but it's without question, is this guy and Bellaterro. So, you have the product of choice, you have the best product, you have the best chance. Does that mean you're not going to have problems? No. You can still have problems with under eye filler at any point. And I'm not talking about blindness. Blindness is exceedingly rare, although it can happen. How does blindness happen? Blindness happens usually in the paramedian regions of the forehead and nose. As you come, there are circuitous vasculature, so there are veins that go around in round fashions here, there, here, and there, and then they dive deep here. So if you ever get into one of those veins and push really hard, you can actually have retrograde movement of filler into various actually portions of veins, or actually cause engorgement down near the optic nerve, and you can cause blindness different ways. But those are very, very rare, and they're also more rare with cannulas. Is there a difference between 27 gauge and 25 gauge cannulas? If you're good, there's no difference. There's no difference between them. If you're trying to decrease your risk because you don't know what you're doing, shouldn't be doing it, but 25 would probably give you less of a chance of cannulation of a vessel. So, Bellaterro is good. What other questions do we have? Let's see. Let's see our questions here. Is Voluma safe? Not in the under eye. Does it ruin skin when you remove filler in order to inject an overcorrected area? So I'll do a separate kind of talk about this, but so you know, Hyaluronidase, which there's Vitrace, is the one that I use, but there's about 3 of them in the US that we use. Hyaluronidase is an enzyme that can dissolve this type of sugar, hyaluronic acid. Hyaluronic acid is a natural part of your soft tissue matrix and your dermis and your SMAS and those things. So if you inject hyaluronidase into any part of your face, you will damage, inherently, you have to damage your own. So any doctor who says you don't is clueless. It doesn't selectively go after hyaluronic acid fillers. It just more easily just passes into them within 2 seconds, rather than it takes like 10 seconds to get into your own and break apart your own. But it will ruin your own too. The benefit though, I'd say, of dissolving the under eye versus here, or the difference is that the under eye doesn't have as much hyaluronic acid. If you go dissolve this area in the midface, it can be devastating because you're gonna shrink the SMAS, you're gonna shrink the dermis, and it's gonna deflate it. And once you damage it, it's damage, it's real damage. It'll take, if it comes back, it'll take 1 year, 3 years. It takes a very long time for that to come back. So when you dissolve, you have to be aware of that. In the lip, I dissolve all the time, and I know this. I've seen it a million times. I've seen it open and close. I know what it looks like. When you dissolve the lip, also you're shrinking the SMAS layer in the lip, and it gets flattened, and it makes the lip look a little flatter. And so sometimes you have to go refill it. So it's good to know that anytime you dissolve something, you might have to refill it, and don't over dissolve or it's going to cause a problem. Again, question came up about Artefill. You never, ever, ever put Artefill, Bellafill, Aquamid, Silicone, Sculptra, Radiesse in the under eye. Never, under any circumstance, unless you are revenge injecting somebody. If you're revenge injecting somebody, like they killed your father or something, and you finally got him into your chair somehow, and they don't know that you know, and you want to not kill them, but ruin their life by making their under eyes look terrible forever, that's when you inject Artefill, Bellafill, Silicone, Radiesse, or Sculptra in the under eye. So everybody knows now, Restylane is the way to go, and Bellaterro is the way to go. The other ones, not so great. And anybody who injects the other ones, I don't understand it, because it's not like you can't just buy Restylane that everybody else uses. So that's it. Any questions you can ask on this. I'll put this talk up so everyone can watch it, and I guess tomorrow, after tomorrow, maybe I'll do one on hyaluronidase, because unfortunately a lot of people are mistaken about hyaluronidase. So maybe I should put some lip filler in too. Yeah. Okay. Bye guys.